Inshallah, we can start. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم صل على سيدنا مولانا محمد وعلى آله سيدنا مولانا محمد وبارك وسلم بسم الله. So welcome everyone to this particular session. This is inshallah going to be a series that we are starting today, and it's planned almost it's going to be an ongoing series, but we already have the lineup until June, inshallah. We will get to that. But to give you an idea what we're trying to cover today and why we have started this series is we want to make sure that our community have resources that they need. Alhamdulillah, we are basically a religious organization, alhamdulillah, but we're providing a lot of services of what our religion is trying to give forward. So we're doing, alhamdulillah, a lot of halakas in the masjid. We are on social media with what our religion is teaching. We're already doing that. But how can we help our community in the other ways also? So we already have the food bank, as you know, that's going on, humanitarian assistance, free clinic that's going, alhamdulillah. But now what else can we do and support our community at this time and see that we just don't do seasonal things, right? That's our entire goal. We want to be connected with the community and provide them the ongoing resources and see that we be the source of the information that people are looking forward to and come to us, and we can connect with the different resources that we have within our community. So Jazakallah Khair, Sister Afshan, she took the lead on this initiative for the mental health awareness series, and mashallah, she is a part of our community for a long time. She has already done similar programs at different organizations in Texas itself, and she will give her own great things that she has been doing in the community. But her professionally, she is a psychiatrist, a child psychiatrist to be particular. So we will get this series going, inshallah, and Sister Afshan Khan is going to lead this series over the time. We will get more resources that are available in our community. So today we are joined by Jenny Larson from Texas Workforce Solution. Today she will also give us what resources we have available in Austin that we as a community may not be aware of, and it may be something that if we know, we avail it, or if someone else knows, we can refer it to her. That will be useful. And that's how a community binding can happen, and we can all benefit from the resources that are available. So that's the main goal for this series. We want to keep it more open, question answers, connected, come up with the questions, give your feedback, how we can improve, what else can we do. So that will be the goal for a long term. So I hand it over to Sister Afshan Khan, and then Jenny will take over after that. We'll also have the open question and answers after that, inshallah. Sister Afshan Khan.
Thank you, Brother Altaf. Assalamu alaikum, everyone. I do telehealth every day, but I'm still struggling, and I'm on my phone with Zoom. So bear with me. If you can't hear me clearly, let me know, and I'll be a little more louder. But thank you to Brother Altaf's tenacity. We are here because he's been after me about this mental health series. So we've got a whole session going on all the way till 2021, middle of the year, and we'll make this regular. We'll talk about topics that we really want to hear. We have some great speakers who have volunteered, given their time, wanting to do pro bono work for our community. So we want to avail their community support. So we would like feedback as we go through these sessions. This is going to be the first one, and then we'll have we have a specific Saturday blocked out for us to do this every month. And then we can bring in other community, big Muslim organizations who are doing more extensive specific community work to kind of come and help us and educate us a little more. So with that, Bismillah, I am a board certified child and adolescent psychiatrist, also an adult psychiatrist. I have a private practice in Westlake, called Austin Family Psychiatry. You can look me up, and if y'all need any kind of help or support, you can kind of directly contact me through my practice. But before I start this, I really wanted to lay out some housekeeping rules. The goal of this talk is to kind of keep it just professional awareness and knowledge about mental health, educate about the resources. By no means we're kind of saying that this is going to be any kind of religious counseling. At least for myself, I really say that I'm here to kind of give more professional guidance. Certainly our background with religion, culture plays a big role, and we can communicate, understand, and connect better. But I really want to know that this is going to be more of professional information and helping out our community to understand the resources. And the whole goal of this is really because there's a lot of lack of mental illness understanding compared to physical illness. When people have diabetes or hypertension, they easily approach people, get help, wanting to kind of understand it, ask their friends, for other doctors to communicate resources and stuff. But when it comes to mental health, we really don't want to kind of talk about it. So the goal is to kind of bring it to the level of awareness and insight that it's just like a physical illness. And, I think for a long time, our community has said, this is not our problems. This is somebody else's problem. This is not our problem. But as American Muslims, I think this is our problem. Mental health is our problem, because I see this all the time. There's a lot of putting it under the carpet. There's a lot of can't do this, it's not happening. A lot of parents wanting to ignore the illness and not want to kind of address. And honestly, sometimes younger kids always say, oh, this is because my parents are brown, that's why they don't want to understand this. That's not true. I see this in all kinds of communities. There's a lot of stigma to mental illness, and a lot of people do not want to talk about it. But honestly, talking about our own Muslim community, we're on getting to the point of being highest in divorce rate compared to other communities. Our college kids are at 40 to 50% of experimenting with alcohol and drugs. There's a lot of things happening in our community. And these are stats from a really well-known Muslim organization called Family Youth Institute that really studies Muslim communities in America. So this is just not numbers that's coming from anywhere. This is numbers in our community, and we can't kind of ignore it anymore. Definitely depression is another most important leading cause of disability. It's big there. It's becoming the most leading cause. The second leading cause now is the first leading cause of disability. And I really appreciate Jennifer Larson to kind of being generous on a weekend to give her time to come educate us about the resources. She comes from Texas Workforce Solution. And thank you, Jennifer. We really appreciate that. I want to kind of focus more on a little bit of child psychiatry, because that's what I do majorly in my practice. And again, sort of talking about resources, 13% of our population of adolescents suffer from depression. That's almost as equal to finding obesity in kids. So if you see an obese kid and you think this is how obesity is so common, so is depression. And I'm going to compare that stats with diabetes. Diabetes is at 0.25. So when you compare it to seeing diabetes in kids and seeing depression, it gives you a scale of 0.25 diabetes. So some of us actually know kids who have diabetes, right? But not a lot of people know people with depression, but it's way more common, more happening. So the goal of this talk really is to kind of divide it into three parts, explain two of the common illnesses that I see, depression, anxiety, and then talk about the uncertainty during this COVID times and how we can kind of work on that, and things that we can do, and then kind of open it up for more interaction. I know if you all have questions, you can raise your hand at the end, put it in a chat bar, and I'm happy to answer those questions. I'm also available on my personal email, that's Afshan Khan MD at Gmail, or through my office manager at Austin Family Psychiatry, if you guys have any personal questions. I want to limit that to no long love letters, simple questions that you guys can ask me, which I can kind of help you with guidance and support. Because there's a lot of times I kind of have questions which are really, can you fix my kid? Can I just come once and things will go away? And this is not happening in my house. I can't answer those kind of questions, but definitely resources and professional help, happy to do that. So we're going to start off with two things that there's a whole slew of mental illness that I see in my practice, but I'm going to really focus on depression and anxiety. Those are the top common things that I see in my population. And I really want to educate people about depression, anxiety, just kind of from a doctor's perspective of what depression looks like and what anxiety looks like and what are the treatments. So it doesn't seem so daunting to go approach for help. It doesn't seem like, oh my God, they're going to put me on medication or hospitalize me or admit me, because those are the top common fears people have when they're talking about depression or suicide or any of those things. Depression, I'm going to define depression is usually, we as professionals say, 2 weeks of having symptoms of lack of sleep, not able to sleep or disruptive sleep, appetite problems, no interest in things, low energy levels. In kids, we often see isolating themselves, staying in the room, not great sleeping, not participating in the schoolwork, not reaching out to their friends, not enjoying things that they have fun. So these are the kind of symptoms that you see. When it kind of gets to the deeper end or extreme, and the depression gets bad, people start having negative thoughts of feeling like hopeless, helpless, not wanting to live, negative thoughts of wanting to hurt themselves. It's part of depression. Suicidal thoughts are pretty common, happens to a lot of people. There's nothing bad about having those, and there's nothing wrong with kind of not treating them or ignoring them. And also, I want to kind of bring this point is, if you have suicidal thoughts, doesn't mean that you have to get hospitalized or admitted. That's, people are afraid to talk about it because they think they'll be admitted in a hospital. So definitely, it's a whole series and spectrum of symptoms you have when you have depression, when you get there. But it all depends on where you are in that stage of depression. And so depression can be for months, can be for weeks, can be for years. Some people have depression, they get better. It all comes in cycles and waves. So it gets better, and then it may come again. You may have a stressor or trigger, and then it happens again. So the goal is to kind of get it treated. So your body, the chemical imbalance that has happened is being treated. We see a lot of people with depression in kids is mostly because schoolwork, family conflict, breakups, friend conflicts, and things like that. And most often, kids will come and the kids suffering, but can't talk to the parents because there's no hope of support from parents, or they don't understand what he's going through. Or more often, he or she's often said that, oh, you get over it. This is not important. You just have to kind of pretend you're not depressed. So there's a lot of depression is almost like a chemical imbalance. Your body drops those chemicals. You feel like you try hard, but you're not getting there. That's depression, what we see. We see a lot of anxiety. Anxiety often presents with not wanting to participate in things again, and restless, pacing up and down, can't sit quiet, can't function. And anxiety, I often say anxiety is a very natural thing. It's okay to have anxiety. There's a good and a bad anxiety. And how do we get to the point of knowing that it's got to the point that we're dysfunctional is when it gets to be bad anxiety. And anxiety is kind of my specialty for kids because it's so common. We see a lot of this. And my goal is to kind of really talk about anxiety more and more as we go by, and how parents can help and how they contribute towards their kids' anxiety and stuff, because that's my kind of specialty. And I do a lot of that talks in schools here, especially when it comes to grades, comes to finals and stuff, how that anxiety is created and all those things. But anxiety can present to the point that kids have panic attacks where they feel like the heart's beating too fast, they can't breathe, they're shaking, they're tremoring, they're not able to focus. Sometimes people have stomach issues. A lot of GI doctors refer me patients because kids have gone to the doctor with multiple GI complaints, like they feel like they're not eating well, they're throwing up and things like that. So it's basically anxiety or headaches. Neurologists with a lot of headaches, common headaches, that they're treating it and it's not getting better. So the goal is to kind of understand those two illnesses, and we'll expand on both of those illnesses as we go through these series. But I really want to kind of focus on treatment options and how we're going to work on coping strategies here. So basically, when people come to me, I do a very integrative psychiatry approach. We're doing a lot of finding out a whole body experience, other environmental factors that are playing a role. And medication is not the only answer here. There's another community doctor, Dr. Qazi Javed. He's a great integrative psychiatrist too in the community. His practice is called integrative psychiatry, and of Austin, I think. And he's awesome too, from a Muslim community support system to do more of that holistic private practice. And so the whole goal is, right, for me, treatment's like a pie. 30% is medication, 30% is therapy, 30% is kind of working on that environment, 10% doing the work. So when you go to a psychiatrist, you don't have to immediately jump to medication based on where you are in the level of 0 to 100, of 0 being, yep, you're depressed, there's some mild symptoms, and we can kind of work through some environmental changes. 2, maybe you're really suicidal and you need hospitalization. So it all will be based on where you are in the treatment plan. But certainly therapy is a big part. Finding a counselor, being able to talk, because most times kids really need that space without judgment, which is therapeutic, non-judgmental space for them to kind of communicate. Environment plays a big role. Sleep and appetite. I can't sell enough of sleep to teenagers these days. There's so much of lack of sleep in teenagers with social media, screen time, and stuff. So really focusing on sleep as religiously as a part, and we can kind of talk more about it as we go through the series. And then working on eating healthy. There's a lot of new stuff coming out on nutritional psychiatry. I know as a big corporate America, we are not so focused of beyond pharma, but UK, Australia, Canada is focusing a lot more on nutritional psychiatry. And to give you an example of that nutrition psychiatry is I went to one of those conferences and they talked about eating salmon for your brain and ADHD and focus and attention. And I was like, I don't need this. I eat enough salmon. There's no need for supplements to be added on. And then this Oxford research person showed me the amount of salmon one needs to eat, like 3 big flanks of salmon every day for 3 nights a week in your dinner to kind of get the amount of omega-3 fatty acids. So clearly we're not getting enough nutritional food, and that's going to be a big role in adding those supplements sometimes to kind of support your brain and nutrition. So we've seen a lot of success with some micronutrient supplementation, which is over the counter for depression and anxiety. So there are resources out there to treat some of the psychiatry with nutrition. Again, that will be based on an individual and their treatment plan, but sort of just to get you all educated on is there are resources other than just pharma industry medication that people can take to get them help for their depression and anxiety. And then sort of just, the other question I often get is how long can I take medications? How long do I have to take medications? And one of us asked me that question about bipolar and how we can kind of get bipolar, how long one has to be on a medication. It's a very tough question to answer until you know the case completely. But I would say on an average, when I talk to people, I say when it's depression, people need to be on medication at least 6 months. And if they want to prevent relapse and not have it, at least 2 years. So when people come in, they start on medication. The goal is as they start on medications, helps them fast forward the process of thinking. They're able to engage better in therapy. They're able to reach out to their friends and kind of eventually the body is going to produce their own chemicals. They're going to do some more physical activity, eat healthy, all of this, and eventually you can get them off the medication. Again, it depends upon the illness. If it's bipolar, sometimes keeping that mood stable on medication longer is helpful because then, but it doesn't have to be on high doses and it can always be monitored by psychiatrists closely and change medication. So medications can be based on each person's case. We have people come in, take meds, get better, and then we get them off in 6 months. I get a lot of 9th graders who who are stressed out because of their high school. Got there feeling overwhelmed, do not want to drop any of their pre-AP classes at all, want to keep up 5 of the pre-AP classes, want to keep up their sports, want to keep up with the pressure of making the parents happy with their grades. So they do a lot of that and they're not ready to kind of cut down. So it takes medication sometimes to kind of get them thinking and saying, okay, maybe I don't need this, maybe I need this. And because they're not able to think, and medication helps in that part. So it's hard to kind of say how long one needs medication, but certainly we say 6 months to 2 years to treat depression and anxiety. And then moving on to kind of this uncertainty during the COVID times. We've had a lot of online resources. We did a talk before with Dr. Siddiqui and Sheikh Islam on this about things to do. Take walks, create structure, create some sort of routine. There's a lot of things out there. The 4 M's I often say is the mindfulness, movement, creating a mastery on something and focusing on your mental health, staying physically active, trying to create something else that you can stay busy on other than schoolwork or work, and kind of just focusing on saying, okay, if I'm not doing well, I need to take care of myself. And that's another big thing in our community, right? Or in general, people sort of say, taking care of yourself sounds selfish. And I often say selfish doesn't have a negative connotation to it. Selfish is actually good. Because if you don't learn to put yourself first, you can't take care of other people. And that's the goal, is really saying, if I'm not doing well, saying I'm not doing well and getting that help, or focusing on yourself in some way, rather than kind of putting it away. And that kind of leads to more deeper struggles. What I am seeing in young kids is usually with all of these uncertainties, them not knowing what to do. The online school is hassle because you can only sit so much in front of a computer. There's lack of motivation, there's apathy. People do not want to kind of do their schoolwork. Young kids with ADHD cannot sit on Zoom meetings. There's a lot of study on sleep disruptions with REM sleep related to no physical interaction. So a lot of sleep disturbances, irritability, loss of appetite, or eating too much because they're busy with things. So definitely, we're seeing a lot of that. Brother Altaf, I just saw a question, I think, and I can't probably see the question.
I see the
So
question.
yeah, I think the question was about how young do I see? I see young kids as age 3, do a lot of autism. So sometimes 2-year-olds. I have quite a few Muslim clients, and parents come to me when they're really ready. I think maybe a little late, but sometimes they're ready, and they're ready for response to medication. Wise, they take medications. And the other part is, right, when you have a professional walking you through the process, that's the whole goal of a psychiatrist. Is I'm your treatment planner. I kind of sit there with you, tell you what kind of things we need to do, have you kind of monitor with us every 2 weeks. So when somebody comes in, does an assessment in an hour, we kind of sit down with them, explain the process, give them options. And then they start them on an average, we see them first 2 weeks, and then kind of extends out to 4 weeks. But we also want them to get therapy, put all the resources, and address the root causes of the illness. So see people age 3, starting age 3 to all the way to 55. We limit after 55 and send them to geriatric or adult psychiatrists. So in my practice, I see 3-year-olds. And then just talking about parenting skills, really, that is another big key of how we, and I can go on about it. That's a larger topic to talk about. But the top 5 points I'm really going to focus on is validation, empathy, perception, gratitude, and positive reinforcement. Those are going to be my 5 things. And I'm going to try to give as many examples as I can on each of those. Validation part is really kind of telling your kid what they're going through. Just accepting it, kind of saying, yep, this is hard. Often, I think as parents, and I'm guilty of all of these struggles, that I jump into if my kid kind of is saying something, and my immediate response is, well, you don't know, the other people are going through so much, or this is how the other person is doing it, or this is, I think that really invalidates my kid's feeling. And my focus is really to kind of say, let's work on making sure I validate my kid's feeling. If my kid says, oh, this is hard, and you sit with them and just say, this is hard. And that is hard for, because the minute your kid says that, your anxiety rises, and you want to kind of, as a parent, want to protect and save them. So you come up with solutions, you come up with ways of saying, but how about you do this? How about you do that? And you have to really say, no, it's actually my anxiety talking. It's not my kids. My kids just saying, this is hard, or I'm sad, or I'm angry, I'm mad. Instead of listening to that feeling or emotions, I'm so focused on myself and my anxiety. And this is my favorite pet peeve in psychiatry with anxieties. I often say about anxiety is it's like cough and medicine. If you're coughing, your child will cough, and you will take her or him to physician and say, look, I'm coughing, my child is coughing, I gave him the cough, and here I want your help. But when it comes to anxiety, it's different. It's like cough. You cough, your child will cough. It's just that it presents differently in different people. And as adults, we are good at holding anxiety because we know how to manage things, but we don't know how we're transferring that anxiety to our kids. We don't see it, and we kind of struggle with it. I'm going to give a very good example. Is I do this with my kids. Is I often kind of get in the car and say, get on, let's get in, let's go, we're getting late. And then my kids have to remind me, saying that, oh, we're going to HEB, we're not going to school. So that's a very true example of my own anxiety, how I'm kind of constantly anxious, sometimes trying to rush through things, and I pass it on to my kids. And so kids take it in different ways. Some kids present with physical symptoms. I have a lot of younger age group kids who complain of tummy aches. They go through multiple tests, multiple examinations, endoscopies, tests to find out really it's anxiety. Neurology appointments, they present with headaches because the whole family is anxious, but they're able to manage as adults, but the kid cannot. And then it presents in so many different ways. So the biggest part of really when a kid talks to you is validate their feeling. If they said, I'm bored, instead of saying, oh, boredom's a first world problem, let's do something else. And just acknowledge, yeah, I know it could be bored, let's sit down and just be able to sit down with that feeling of that instead of immediately going to give advice. Empathy is another thing along with that, validating. And it is hard to teach empathy, and it's hard to kind of talk about it, but it is hard because we have not learned to have empathy towards mental illness. That's not part of how we were raised. It's not part of how for long we've not been talking about it. So it's hard to understand what depression and anxiety looks like. And the only thing we know to say is get over it. Sometimes we're like, this happens all the time. This is just a phase. Empathy towards gender dysphoria is a new thing that I've been seeing a lot. I've been in this field for 15 years. Years ago, I did not see gender dysphoria. Last 5 years, I worked in an inpatient facility, and we used to see once a month a kid who had gender dysphoria, wanted to kind of program in a different gender than they are. Lately, I'm seeing it. At the end, I've started seeing it every week or 2 weeks, and it's pretty common. You can call it a fad, but the only thing a child needs to know is you're going to support them whatever it is, just to kind of sit with them. I think 50% of the time it becomes more of a rebel issue. So I often tell people is sit with that feeling first, let them kind of speak it out, hear them out without any conversation, communication, judgments, or anything, and let them really just feel like they've heard. And then comes the other part of educating, explaining where you are with it, where you stand on it, and getting resources and kind of explaining it to your kid and kind of working. But I think the biggest mistake parents do when it comes to topics like that is they panic, they're anxious, it's against their beliefs sometimes, and they don't know how to react to it. So there's a lot of empathy that's required in all of these things. The other part is perception. Big struggle. I'm the adult here. I know the world and I know how to deal with things. So I don't need your opinion about how to do things. I do this with my kids so often. My anxiety, like my kids would say, is I only know 2 jobs. Is either you have a profession or you're homeless. So there's no spectrum in between. And my kids judge me for that because all my anxiety arises that if you don't study, you're going to be homeless. So there's a lot of that perception thing that I have to sit with my kids and they have to tell me. Another good example is with my older daughter. She's in basketball last year, Team A. This year she made Team B. And my second child, first time playing basketball, made it to Team B. And my first answer towards, I was a little disappointed at my older daughter not missing out on Team A and being Team T. And my younger kid said to me, I'm excited, at least I won't be benched so much. And I had to wait for a minute and hear it out. And I said, yeah, right. If you are Team B, Team A, and not a great player, you'll probably be benched for a bit. Versus if you're a Team B, unfortunately for my older child, that was a good thing. She became the captain of a Team B. But it took me a while to see her perception. And I think as parents, we often put our perception first because it comes from our negative experiences, it comes from our own parenting experiences, it comes from so really kind of sitting with kids' perception and helping them kind of go through it and hearing them out and just sort of then adding a perception based on how they meet. Because at the end of the day, any mental illness or the world is from how you see it, not for how your parents sees it, how your father sees it, or your mother sees it. It's just from how you see it. And that's what you want the kid to have, a perception of their own. So they believe in their perception and tend to, and then you can give your feedback to make it positive as much as you can. And the other thing I often say is teaching gratitude. Gratitude is a big thing for COVID, I think, for all of us. It's a struggle teaching kids gratitude sometimes when they're frustrated, when they're feeling hopeless. And the only way to do it is kind of living by example. You can use all those words of so-and-so third world country suffering, and you can't be saying that. You can't teach gratitude by that way. I've done that. It doesn't work. Really kind of just getting out and helping them be part of the community work is a good example. NMCC is doing a great work. I've got my kids out. If I'd ask them to throw something, if they're eating something, there's a little spot on a bit apple and they're like, not eating it, it's spoiled. Take them out, let them do some community work. When they see things, they really appreciate what they have. That's better than kind of giving them advices. The other thing I often talk about positive reinforcement is there's research out there that if you're going to make negative comments towards your child, for every 3 negative comments that you make in a day, there should be 9 positive comments. So really, if you're going to say that, oh, you haven't done well at schoolwork, you suck at this, or you're going to say something like that, then you really have to add it. Say for every 3 of those, I have 9 more positive things to say about my child. Honestly, this is so hard to do than said. And this is research based on how many number of negatives and positives you need to add to kind of do that parenting part. And parenting is an art in a lot of ways. We just have to improvise it on a daily basis. We do parenting from how our parents parented us. So there's a lot of work that needs to be done if that hasn't been completely satisfying or there's been some struggle there. But certainly I say that you just have to be a good enough parent. There's no requirement on saying you have to be perfect. If I do this, my child is going to get this problem, or creating the guilt that if I didn't take care of them in this way or that way, this is how I'm going to get to. We don't want to kind of get there. All we need to be is good enough. That's what psychiatry says. That's what research says, is we can't aim for perfection and kind of push ourselves or throw that guilt on a mom and say, hey, you're not doing a good job at it, or dad saying you're not doing a good job. Nobody's there to judge your parenting. You make your own standard, and that just has to be good enough from your perspective, and not taking in that guilt to replay, so kids pick up on those things and act from there. So really kind of, I'm going to open up some of this for interaction, because these are the only things that I have for today, and then we can kind of go from there. Brother Altaf?
Sure. Do we want to address some questions?
Sure.
One of the questions that I myself has is one of the questions that I myself has is what is this mental illness? How does it even start with? Right? What is the cause of it?
So basically there's both nature and nurture, right? When genetically they say if one of the parent has a mood disorder, there's a 25% chance of having mood disorder, just like diabetes and hypertension. If there's a family history, there's a genetic component, it's there. Unfortunately, with other illnesses, there's so many blood tests, they test to tell people that you have this. With mental illness, we're way far out there yet. And how we can kind of treat, we've got a lot of that understanding yet to come up. We do have one gene site test, which kind of does your blood test to tell you which medications may or may not work. So they do a cheek swab and send it out. And then they tell you that, hey, if you had to use a medication, can be a roadmap. It's not perfect. It's 50-50, but we are there on one test. Thyroid problems. If people have thyroid problems, they can have depression and anxiety because thyroid hormonal changes. A lot is being studied on female hormones lately. Perimenopausal women, hormonal changes play a big role in your mood disorder. And I'm going to call it mood disorder because it can be depression, it can be anxiety, it can be bipolar. Bipolar is the other illness, which is like highs and lows, and your mood is up and down. So definitely female hormones, that's been studied a lot lately. Low testosterone in men is being studied to kind of with depression, but we do not have any specific genetic problems. So you could probably get a gene, and then you have a stressful event, and you're not producing enough serotonin. Serotonin is a chemical that's kind of leads to some of those imbalances that leads to your mood disorders. So you're not producing that, and then it all adds up that you're not sleeping well. Then there's less of chemical production, and then it leads to depression. So definitely there's some genetic part, but a lot of environment factors play a role on. And most often it's when we kind of do the assessment, we ask people is, has there been a recent change or a big trigger in your life? So that's where, so there's no specific answer on how mental illness happens. But if one parent has it, it's 25%. If both parents have depression, anxiety, it's 50% chance that you will have it, depression, anxiety. And then people have depression, anxiety, and they learn that because sometimes it's kind of nurture, right? You don't have the coping strategies. You're a ninth grader. You're there, and nobody's talked about your symptoms or signs, and nobody's kind of giving you the support to, oh my God, if I only slept better. Because I have kids who don't even realize how much they're losing sleep on homework and not eating well, and then that leads to, and then all we sometimes do is, okay, let's bring in more sleep hygiene, let's get you a space, let's get you to school to understand how you're struggling and this is too much for you. That's a whole, education is another pet peeve for me. We can go on it about how it puts people in boxes and expectations, and how not all kids are made to do the same thing. So to answer your question, mental illness can be genetic, some of it, and it could be environment. Yeah.
I have one
and
more
I think
question.
somebody asked another question about how does ADHD relate to depression? So ADHD by itself is a whole different diagnosis. For child psychiatry, it's the bread and butter. We see a lot of those kids, ADHD. So ADHD is a mental illness in a way that you have difficulty focusing, paying attention, being easily distracted, poor focus and attention problems. So people have ADHD as a child. So it starts off as kids from 3-year-old. They're not able to sit in their place. They can't go through finishing up the schoolwork. They're distracted. They're talking to other people. They're hyperactive, fidgety. So ADHD is a very common thing. If the kid is hyperactive, the teacher will call the parent and say, hey, your kid's not sitting in his place, needs to do something. It's distracting. Again, 21 kids, one teacher. The teacher wants everybody to sit down and focus, and if you're not doing that. But the distraction part is, if your kid is not hyperactive, there's another kind of ADHD where it's inattention type, where you're just sitting there, but you're lost in your thoughts. You're not able to finish your work. Often kids do not get diagnosed with, the kids who have ADHD with inattention don't get diagnosed. So we see a lot of middle schoolers and high schoolers often presenting with depression and anxiety. So, and then when we kind of go through the assessment, we often ask, has anybody ever told you you have ADHD? And they're like, well, maybe a third grade teacher once did. So to kind of answer the question, is ADHD related to depression? You can have both of it separately, or if you have untreated ADHD, it can lead to depression. And that happens because you're not able to focus, you're not able to do your work. Then you start going into this vicious cycle of judging yourself, poor self-esteem, guilt about things. You start kind of thinking about, hey, I'm not good enough. And then that leads to depression and all of that. So ADHD could be related to depression, or ADHD could be different from depression. But that needs a full assessment to kind of tell the difference if it's just ADHD related depression, or regardless, I think getting the ADHD treated sometimes helps people get the depression treated. So definitely that would be something we could do. So yeah. Is there anything else that we need to talk about, or?
Oh, one more question that I had is in terms of like behaviors in kids. Like we know that each and every kid is different. They will behave in a different way. They will react it in a different way. So what is the standard benchmark? Like how can we say that, this kid is hyperactive, this kid is distracting? Like is there like maybe his personality is like that? Or how do we differentiate personality versus the disease?
So right, some people are hyperactive, some kids are supposed to jump, run, be wild. That's what childhood is all about, I think. And that has changed a lot for our kids from when we grew up or something, because things were allowed so much different than they are allowed now. And I think that's another school environment factor, right? A lot of people are put in little boxes, 21 kids, one teacher, expectation of wanting to stay in the class, do the things. I often say when people have ADHD or have that struggle, right, is 1/3 of those kids do really better. They kind of outgrow it. They kind of learn organization skills. They learn to kind of deal with. 1/3 of kids really have ADHD and need to be treated all their life. 1/3 actually have a different illness like anxiety, bipolar, and will misdiagnose the ADHD. So when you kind of say which kid has ADHD and which doesn't is really such a functionality question, I say. Is if you can work through your kid to teach them to be able to focus, because it's a retraining of the brain at some extent, right? You don't have your brain, you're different in a way that you process things different. So there's a lot of environmental support schools are bringing in now. Is they don't want everybody to be medicated all the time, and we certainly do not like ADHD so much because we get 300 calls as a college town from college kids wanting to get on ADHD medication because it works. It is, you take it, it works, you don't take it, it doesn't work. So we get a lot of those calls and we try to avoid adult ADHD. But in kids, it's really kind of boils down to, can we get him to create, I have parents who come in and we're like, let's start some micronutrient supplementation, very holistic approach. Some families to answer is this a personality or things? Is sometimes you kind of teach the kid as a kid grows, you say, hey, as a mother, I've learned myself is not to give my child 3 tasks. Pick that socks, put it in the basket, take it upstairs and come back and do this. It's not going to work for my 7-year-old. So I have to say, pick the socks, put it in the basket, come back, and then give the second task. So retraining kids' brain on doing 1 task at a time rather than asking them to do 3 tasks. And then you're upset at them because they've not done half of the task. And school have resources. There's a lot of 504 accommodations from the law of every child has a right to education. Schools do their own accommodations. So if you don't want a kid, you feel like, hey, my kid is struggling with this personality or hyperactivity, let's work on creating structure for them. Let's help them understand that this is the school environment. You got to sit, you got to do things. They have aid. They create ways to kind of bring the child front of the class, have the space, a little more time for assignments. So school does a lot of resources to help the child without, and then if that's not working, then medication, the ADHD part comes in, right?
So what is the path? Like say that some teacher says, okay, this kid needs some help. What is the path forward? Where do we go? How do we approach? What are the resources available?
So the first thing is most pediatricians do it in their clinic. Most pediatricians treat ADHD in their clinic. But if you really want it to be tweaked, because then the pediatricians bring you back in 6 months, take this medication, come back in 3 months. Well, I mean, I'm not speaking for all pediatricians, but some. But if you go to a psychiatrist, they probably do a whole assessment. If you have a lot more money, you can do a psychological testing, which does an IQ testing, teaches you where the verbal memory is and understanding things. So definitely seeing a psychiatrist, and then we start from there based on how bad the ADHD is. If I have a 3 or 4-year-old, I'm not jumping to medication immediately. We're doing micronutrient supplementation lately, and that's sort of just adding omega-3 fatty acid, adding some over-the-counter medications to help them support their brain. Bringing in a therapist, sometimes a behavioral therapist helps, somebody who is not a parent, who's therapeutic and can teach them skills to kind of manage that ADHD and teach them ways of, I can do it this way too. Maybe I can do this and things like that. But if that fails, then medication is option. In medication, there are 2 options. One are like what's called the stimulants that are like ADHD medications has street value. So they're very controlled substances. And the other one is a non-stimulant, which has to be taken every day. But the stimulant works like Tylenol. You take it, it works. You don't take it, it doesn't work. So you get on it and it helps you sort of keep you going in a way to be able to focus and pay attention. With kids, sleep and appetite is the biggest issue with those medications. Because it's activating and helps you focus, sometimes you have difficulty sleeping. And because it is stimulant, it suppresses your appetite. So people have struggles with gaining weight or growing up on those medications sometimes. So that's something closely monitored, tweaked, changed, or weekend breaks and things like that to help with things. There's another question here.
I have a question.
Yes.
So what is the difference between depression symptoms in children and adults? Like, is it the same symptoms? Because I feel like we are more aware of the adult depression and anxiety symptoms, but no one like talk about these symptoms in children. So is it the same or different?
So, I mean, with adults or kids, depression pretty much same. It's like usually it's the difference of if you're seeing a teenager, often it presents so the most common thing is parents miss out on depression in teenagers. Often they say, I didn't think it was depression because I thought this was just teenage hormones. And that's what we see more in men, male kids or younger men, is we see a lot of irritability, aggression, not wanting to participate, snappy, anger. A lot of teenagers present with a lot of irritability, which is not common in adults. Adults, we see a lot more of isolation, lack of motivation and stuff. But with teenagers, it's really, so how do you say the difference between a teenage depressed kid versus a teenage kid with hormonal changes? Is The irritability, it's again, the drawing borderline part is functionality. Is I have a teenager who is really frustrated, irritable, but it gets to the point that's creating chaos in the home. It's causing grade slipping. It's causing not wanting to engage in people and isolating themselves. Then that is more signs of depression, and then that can be assessed further, and we can ask more questions and get the answer. Versus a teenager would be like, okay, I'm irritable, I hate my parents, but I'm having fun with my friends. I'm going out and laughing and joking and having a good time, and I'm doing okay on my school. I'm failing because I'm not interested, but that's got nothing to do with my mood symptoms. So that's a good way of differentiating between adult or teenage depression. In little kids, often depression presents with staying quiet. Younger kids, less than 10, 12, sometimes 12-year-old adolescent boys are aggressive or angry and snappy. And again, like I said, the biggest part of when it needs to be addressed is if I feel it, my family's feeling it, everybody's, because, and sometimes I often say is people come to me when things have got really chaotic. And I'm like, how are you doing this? Well, I thought this was normal. And I'm like, no, this is not. So there's a lot of understanding and sitting back and saying, does my kid has these struggles, sleep, appetite problems, irritability, anger, agitation, isolating, has been ongoing for a long time, we're getting into a lot of conflicts at home, then time to kind of address it. So with kids, it's more, young kids is just, you'll see them not engaging, a lot of anxieties, selective mutism, young kids don't talk much about it. So that's the way we kind of see the difference. There's another question about is the depression, anxiety, and gender dysphoria is when your kid's not wanting, we really need to kind of get them engaged. The best thing to do is find a therapist of their choice. It always starts with the therapist but when parents find a therapist, they want to go talk to the therapist first. And I often say first step is sometimes kind of taking them to a provider like a psychiatrist or a therapist and saying, I'm not going to communicate, because when people walk into my office, I say to parents or the kid is, I'm really here as an advocate for the child. I'm not here to kind of be the messenger between a parent and a child. I'm really here to talk for your child. And if there's anything concerning, and that's going to be our space, right? This is our space that we keep all their feelings and emotion. And if I am concerned about safety from your child's perspective, that's when I'm going to really communicate. And I tell this to the child too. And most therapists do this. They kind of go out and tell the child is, I'm here for you. And if I am concerned at any point that there's risk to you or others, then I'm going to communicate to your parents some of your emotions. So I think building that trust first to start off for the kid to be able to speak about those things and say, I think the most often what happens is when you make an appointment, you're the first one who goes into the appointment. So the child feels like, well, this person is going to listen to my mom and dad and not talk to me. So definitely getting your child to buy into treatment is hard, but getting them to find a therapist where you say, okay, I'm not going to be part of this treatment. It's for you to find a space and be able to engage and communicate, because that's going to be a big part. The other thing we see with kids with depression, anxiety is cutting. It's the most common coping strategy. I just call it a coping strategy, a negative one, because that's pretty common, because kids want to kind of feel physical pain rather than mental pain. It's hard. So when kids come in with cutting, I often first make a suicidal assessment and finding out, is this risk to self or others, or is it more of a coping strategy? And if it's a coping strategy, I don't label it as in a negative connotation. Just said, okay, this is a coping strategy, it's a negative one. Let's try to replace it with positive one, instead of kind of making it, it becomes a big thing in families when they see the kids are cutting. So kind of working on really not making it a hyper focus. The other struggle sometimes that I see in families is people come to me and the problem is never the kid. It's actually the family. There's a lot more conflict between parents. There's chaos. But because they don't want to focus on their issues, the child becomes the primary victim. We end up sending a lot of those to family therapy and really kind of figuring out, because the child may have mild depression, but there's a lot of more chaos happening at home between parents, other siblings, and not being addressed, because the kid becomes like this primary victim of saying, oh, my kids have depression, let's treat on her and focus on her rather than other issues. So there's a lot of room for family therapy. So somebody asked me a question about if Austin is a good place to raise a child with autism. You know, I don't know. Texas is 48th in mental health. I worked in 3 states before. I worked in Maine, I worked in California, and I work here now. But I have to say, I really think there are other states who do a great job with resources with autism, or mental illness. Texas probably is not the best, but maybe one day we will. So it's a hard question to answer. I know a friend of mine has kids in Chicago, and I've recommended her to move to Austin, and she's like, I'm not moving. I've got really good resources here in Springfield, Illinois. So it's hard to say. But California definitely is one of the best, if you can. So, Brother Altaf, you there?
Yes, I'm here. MashaAllah, very interesting and very informative. So I think we are on time right now, and we can proceed to Jenny, and let's see what she has, what resources she has for us, and what we can really look forward to. Go ahead, Jenny.
Find my unmute button real quick, as we were talking about technology issues earlier. Yeah, thanks everyone for your time today. I am a vocational rehabilitation counselor with Texas Workforce Solutions. And we are kind of a little bit of a hidden gem. We are a state agency under the Texas Workforce Commission, but what our services are aimed at is helping people with disabilities prepare for, enter, engage, and advance in employment. So just as Dr. Khan was saying earlier, you know, mental health is very much needs to be treated like it's a physical disability as well. And so we work with a variety of people, not only adults, but we do actually work with youth starting at the age of 14 to work on addressing any disability related needs that may be impacting employment currently or preventing them from pursuing employment at this time. We also work with a lot of businesses in the community to spread awareness of disabilities and accommodation rights in the workplace, and building partnerships with businesses so that we can make referrals to our customers for employment when they are ready for that next step. When it comes to mental health concerns, probably the largest population of customers that I work with do have mental health concerns. We also work, you know, our criteria for services are to have, number one, having a documentation of disability, if that's physical disability, emotional disability, learning disabilities. And so if you have a diagnosis currently, you know, coming into our services, we can discuss from there. If you suspect that you may have a disability, we can guide you through that process of getting an assessment and establishing services. A lot of time that's what we are doing with customers when they come in and apply for services. Is I just met with someone the other day who feels he's struggled with anxiety his entire life, and he's 53. And so what we're doing now is not only referring them to resources in the community, but we're actually helping him obtain that assessment. Like Dr. Khan was saying, you know, sometimes if you have a child working with the schools or seeking care from your medical doctor or a psychiatrist like Dr. Khan on your own, we can actually help coordinate those services and pay for them at times. So it's really important, if you are having concerns and you don't have a diagnosis already, but you have concerns, it's really important to seek out that treatment. If it's talking with a medical doctor or seeking out a psychiatrist, or even seeking out our services to help you navigate that. For our services, we do have 4 criteria to our eligibility process. It's having that documentation of disability, which I said we can assist in obtaining, and showing that you have barriers to employment. So this could be, if you are struggling with depression, anxiety, ADHD, or having some physical limitations or learning disabilities, and it's not just going to affect your mood and how you're feeling. It impacts everything in your life. Your functioning capability for school or for work, that motivation, staying on task, being able to function day to day. We have a lot of services that can help a person address those concerns. That could be, like I said, setting up counseling services, having assessments, even having support to determine what is going to be the best job match for you in the future. And if you are going to need accommodations on the job, determining what those supports would be and knowing how to have those conversations with your current employer or a future employer to make sure that you are successful in work. With our services, how it starts is we kind of have a process for coming into services. The first step is that initial contact, which is really, it's a 5-minute phone call that can be with me. Just getting your basic information, contact information, and what your reported disability is. If you already have documentation of a disability, that's great. Or if you don't have documentation yet, but you are suspecting a disability, if it's a mental health concern, a learning disability, we just need to know what you're concerned about and what those barriers are. So from that initial contact, you are assigned to a VR counselor like myself at the office that's closest to your home. And then that counselor will contact you to arrange for an application and interview, just to kind of get more information, go in depth, and then determine how are we going to get that documentation necessary in order to determine you eligible for services. So it may be requesting medical records to show that documentation of disability, or helping you arrange for an evaluation to have that documentation of disability before we can move forward. If you are determined eligible for services, we move into an assessing and planning phase. And that's where we identify what's the employment goal. If you're working already, that's great. If you're not, we can do some exploration together. And then also figuring out what are your current barriers. And like I said, when it comes to mental health concerns, you do need to be addressing it in some way. I always tell my customers, employment is our end goal, but the first step is being stable with a physical condition, with a mental health condition, making sure that you're taking care of yourself and in a good place before we get to that end result of employment. That could be, like Dr. Khan had said earlier, it doesn't have to be medication, but medication is an option. We can also help you explore, counseling services, self-care, utilizing other resources in the community to help you move towards that stability so that you are functioning at your optimum level for the future. Once you're employed and working, we continue to monitor you for 90 days at work, just checking in with you, checking in with your employer if needed, to make sure that if you are having any concerns, that we are still here to make sure that you are stable and working successfully in the community. When it comes to youth, like I said, we can start working with youth as early as age 14. A lot of times it's looking at making sure that you are utilizing services available in the school district. And then, maybe working with other agencies in the community and starting to do that career exploration as well, starting as young as age 14. I'm an adult general VR counselor. So my population that I work with is starting at age 18 up until, I think my oldest customer has been 78. And working with a variety of different customers with various disabilities. A lot of them, like I said, is mental health concerns. We also have counselors who specialize in working with customers that are deaf or hard of hearing, customers that are on the autism spectrum, veterans, transition age counselors, and then also customers who are blind or have visual impairments. So as far as community resources go, there's a few, like I said, that's kind of part of our assessing and planning, and throughout our services is making sure that our customers are stable and have access to resources in the community. There's a lot of things that our agency can provide financial support for. If it's having evaluations done, even counseling services, medical services, medical equipment, things like that. Our services are intended to be short term. So when it comes to something like having counseling services, we can help arrange those and pay for them on a short-term basis, typically up to 15 sessions of counseling. But if a customer knows that they may need counseling services more long-term, we can work with them. If they have health insurance, let's look and see who's in your network who may be able to provide those long-term services, or referring them to other community agencies as well. But like I said, we do also have the capacity of providing financial support for some of those services when it's needed. Several of the resources, community resources that are free in the community when it comes to mental health concerns that I refer customers to a lot. One of them is NAMI, and that's the North American Alliance for Mental Illness. Right now, their services are running virtually with COVID, but they have informal support groups. So NAMI works with people who have mental health concerns. They have support groups that run informally several times a month. When they're in person, they have 2 that are in South Austin and then 2 that are in North Austin a month. But at this time, it's a total of 4 that you could use citywide as a resource. They also have a great peer-to-peer 10-week training program that's a little bit more in-depth, and a program that you sign up for. But those are 2 free programs available with NAMI. Another resource that does a lot for people with mental health concerns is Austin Clubhouse. And again, their services right now are running virtually. They do not necessarily that support group or individual counseling, but they do a lot of more interactive self-care activities. They have yoga on their schedule that they run. I believe it's 2 or 3 times a week. They have a course available for employment services. They even have, when things get back to normal again, they have a lot of volunteer opportunities at Austin Clubhouse for you to work on skill building and build that community of support. When it comes to mental health concerns, addressing that disability, figuring out what's going to work for you so that you feel confident in yourself, but also having a community of support is so vital in making sure that you are functioning at your best level and positive and able to move forward. So those are 2 resources I utilize a lot. And I can put in the chat too links to their websites. If that would be info, I would encourage anyone who is struggling, use those resources in your community. Doing some searches. Integral Care is another one. They offer a variety of services that are free or low cost. That can be medication management, assisting with counseling services, case management services for people who have developmental disabilities, and a crisis support as well. I know one person had just asked a little while ago about resources for their 13-year-old who's kind of resistant. And I absolutely love, Dr. Khan, what you said, finding a therapist who is just going to work with your daughter at this time and not focus on talking with the parents at all. I think that's a lot of times with kids and adults, there is such a stigma to mental health, and people are told you just need to suck it up. And, you don't have anything to be depressed about. What's your problem? And so it's a lot of shame of having mental health concerns. And then as a young adult, not wanting maybe to share things with your parents and having that trust. So definitely not giving them the option of, well, they don't want to do anything, so I'm just going to hope that it gets better. Definitely look at seeking out that help and saying, this is something you're going to do, but I'm going to back away from that. There's also a couple of resources though online that may be really helpful. One of them is there's actually a text crisis line. And for young adults, you know, they don't like talking, but they love texting. There's a crisis text line. And all you have to do is text the word connect, and that's CONNECT, to the number 741-741. And that might be a resource maybe your teen might be interested in utilizing. As far as gender dysphoria, there's 2 great websites that might be a resource for you as well as your young adult. One of them, this is helping identify with that gender dysphoria, it's called itgetsbetter.org. The other one is, this is a national organization, and they work with LGBT community under the age of 25, is called the Trevor Project. So those are just 2 additional resources. Definitely look at that, you know, that counselor or psychiatrist support, but, you know, kind of looking at some of those websites too, maybe a really great resource for you and for your young adult as they're struggling, you know, right now with that gender dysphoria as well. But when it does come to, if you are interested in learning more about our VR services and how we can help you, you know, address any disability related needs, if it is impacting your current employment or you know, impacting you from moving forward towards pursuing employment, definitely reach out to me. I'm going to share my screen just so that you guys have my contact info real quick, if I can figure it out here.
Jenny, the other thing we're doing is,
I'll type it in on the bottom. I'm not able to share. But the first step with our services, like I said, is reaching out to me to apply for services. It's a 5-minute phone call just to get that basic information, and then moving into how can our services help you address your mental health concerns by providing resources, supports for employment, helping you get set up with assessments and counseling services, or exploring what's going to help you on that journey to stability and happiness.
Jenny, thank you. We're also, the next speaker is going to come next month, is pretty proactive in creating a directory. So we might take more of your help on kind of putting all the resources. So it's on our website, at our mosque website.
Okay.
But we'll probably will kind of need your help putting all of those things together too.
Sure. I'm just typing in here my contact information. If you have questions about our services, like I said, give me a call, send me an email, and we can discuss next steps from there. I cannot talk and type at the same time. So some of those resources, I'm going to type those in right now too, just for a little bit of exploration for people.
Right. Can I ask a couple of questions so make it a little more simpler for people to understand? So the one thing is, if we have adult kids who are involved in substance abuse and the parents are worried that then there's the substance, been to rehab, back, but not working, what kind of help could we get?
Yeah, so our services are so individualized. A lot of times people will say, well, I would like to see a list of all of the services that you provide. And everything is so individualized to each customer. So with someone who does have substance use issues from the past, that is actually a qualifying criteria for us. So like I said, our eligibility is having documentation of a disability.
So when you say documented diagnosis, does it come from psychiatrists? Does it mean to have that they have an SSDI diagnosis?
No, not some of our customers do receive Social Security, not all of them do. So when it comes to having a diagnosis for mental health concerns or substance use, I mean, it could be from a psychiatric evaluation, it could be from school records, it could be, let's say that they've been to treatment facilities, having records that they have participated in treatment. And that's kind of something that we figure out when we are in that application meeting is, what records do you have right now that we could request, get signed consent, and we could request those records if you're not able to provide them to us. If you don't have that documentation, let's say someone has been struggling with addiction, but it's not been to treatment before, we can assist in coordinating that assessment and pay for it to determine if there's documentation of disability, and then knowing that there are barriers, you know, to employment, and that a lot of times when it's substance abuse, it's maintaining that sobriety and stability. Mm-hmm. And so providing resources, let's make sure that you're stable and in a good place. And then let's do some discovery. Young adults, they don't know what they want to do for work, disability or not, they don't know what they want to do. Yeah. And so we can do that exploration for employment. We can do some assessments, vocational assessments, or, you know, just discussions with your counselor to determine, you know, what are your interests, what are your skills, and then helping them navigate what might be a realistic employment goal for you for the future. So that's kind of what our assessing and planning time is figuring out the employment goal, and then what do we need to do to get there? Do we need to make sure that you're hooked up with resources to maintain sobriety? Or, you know, do we need to establish some counseling services, medication services, if that's been recommended, to kind of establish that stability, right? Before we start moving into the job search. Sometimes the job search is just navigating support with your counselor, you know, maybe a little tutorials on how to do your resume, practicing interview skills, providing support for job searching online is something you can do with your counselor. But for someone who may need more one-on-one support, that's where our employment services can come in to provide that one-on-one support for the job search. And if needed, even provide one-on-one support on the job to make sure that someone's able to complete the job duties, you know, and get any accommodations that are needed from their employer.
Would that apply to another example would be a middle-aged woman who did not work, homemaker, because maybe depression, maybe family, and now kind of has depression diagnosed by a primary care physician on meds, but would like to get into the workforce, has no support how to do it, and does not know how much of disability is playing a role. Can they reach out to you and say, hey, this is where I am, I really want to go to work, but I have no guidance?
Absolutely. Career exploration is a big part of what we do. We call that counseling and guidance, but it is, and like I said, it can be in our planning phase, we do that discovery. We can even, for someone who has an employment goal, and we always want to make sure that that employment goal is realistic based on their disabilities. You know, if someone has learning disabilities, you know, trying to attain, you know, a medical degree may not be realistic, or someone who has a lot of anxiety, working with a lot of direct contact with customers or doing presentations like this may not be realistic for them, right? If their anxiety levels are that high. So figuring out what an employment goal is, and even assisting with training, you know, figuring out if that homemaker, you know, let's say that she's really good on computers. She has a history of, you know, working on them at home, loves to help her kids with stuff. We may help her explore that IT career and even help pay for training in that program. Really, the two main things are, do you have a disability, and is employment your goal, and you don't know how to get from where you're at right now to employment? That's kind of, you know, that's, if the answer is yes to those questions, I would say definitely reach out to us, right? Because we're here to help you address your disability and help you get to employment, even if you don't know what that looks like for you yet. That's what our services are here for. We aren't time limited, although our services are intended to be short term. You know, it takes as long as it takes to be stable and get to employment. So I have customers who've been in services for several years as they're working towards an employment goal, or I've had customers who come into services for 6 months and then, you know, they're able to enter employment and be successful and we close their case. So it's everything we do is individualized to the customer to help them determine what's my employment goal, how do I get stability, especially with mental health concerns, how do I get stability so that I can end up, you know, contributing to my community and working in the field that I would like to, that's realistic for me.
Yeah. Because I have a lot of middle-aged women, young adults who haven't been the learning disability hasn't been understood. They didn't do well at school and now they're unemployed because nobody really said you have struggles, you have disability. They always labeled as lazy.
Right.
You don't
I
have
used to be a special education teacher for high school, and I worked primarily with young adults with learning disabilities and mental health concerns. And like you had said earlier, you know, when someone has a physical disability, they get help a lot of times. And if you have that invisible disability, people just see you as you're lazy, you're labeled as crazy, and there's a lot of stigma with that, and you don't get support, you know, especially if you're not comfortable enough to talk about it. And so, you know, that's where those assessments and that planning time with the counselor become such a key role in helping somebody move forward, because just because you have a disability does not mean that you cannot be successful in life, doesn't mean that you cannot be happy. But you're going to need support, and everybody needs support in some way or another. So the hardest step is that first one, which is reaching out to say, I need help. And, you know, contacting my agency, reaching out to Dr. Khan, you know, that's going to be the hardest step, but we are here. Texas Workforce Solutions is here to help you address any of those concerns in order to move forward.
Jenny, a question. If there is someone that we feel like he or she needs help, they probably think that they're doing all right. They probably don't have resources to be identified or be diagnosed. Is it okay that we refer them to you and then you take the next step with them, or how should we proceed with that kind of a situation where we know that this person is coming and he really needs help, you know, whatever other resources that they needed, we have already provided to them. But at this point, it looks like they really need help in terms of either mental or they have some kind of a disability. But we are not certain, we are not experts at that, but we definitely can see in them.
Right. Yeah. And definitely reach out. You know, that initial contact to be assigned to a counselor is just, you don't already have to have that documentation of disability. But if you suspect it, you know, that homemaker who thinks, I think I have a learning disability, or struggling with depression, anxiety, you know, just having that suspicion, I think that there's something going on and it's impacting me where I can't pursue employment. I'm struggling at work right now with motivation, you know, getting things done. You know that it's impacting you, reach out to us. And that initial meeting to complete your application and interview, we'll talk about that. You know, if you don't have documentation right now, or you've not worked with somebody before in the past about your disability, tell me about what you're experiencing right now. You know, if it is depression, you know, I'm sleeping a lot or not being able to sleep or struggling with motivation. We have those discussions of what are your symptoms looking like? You know, what are the barriers for you right now? And we can assist with that assessment. That's something probably 25%, at least 25% of the people who apply for services, my initial meeting with them, I end up sending them for an evaluation to have documentation of a disability because they don't have it previously. And so it's just, we can help navigate, navigate having those assessments done in order to determine eligibility. And if there is no documentation, let's say that we send them for the evaluation and they say there's no disability or they're not eligible for services, we can still refer them to other agencies in
Okay, that's good.
who may be able to help, address any of those concerns.
Yeah. These are the people that they basically really want to work, but they find themselves out of place, or they don't want, people don't want to hire them for, basically they find them that they are not able to do the work or
Right.
things like that.
I mean, yeah, getting through, if you're struggling with mental health concerns, depression, anxiety, going to I get nervous going to an interview, when I'm in a good place. And so it can be a struggle if you are having mental health concerns, getting through that interview, or when you get on the job, you can do it, but your anxiety is preventing you from, remembering what you're supposed to do and interacting with all of these people. Your disability starts to affect you when it shouldn't be. And so, or it's affecting you more that you're capable of doing more, but your anxiety is preventing you from doing what you know that you can. Absolutely reaching out to our services so that we can help you figure out, okay, what do you need to do for yourself to be in a good place, but also looking at that work environment too, right? There's several factors that play into somebody's disability. And it's not just, trying to fix your disability, but also making sure that you are setting yourself up for success in an appropriate work environment.
All right. Thank you, Jenny. Thank you, Sister Afshan, and Jazakallah khair, everyone. I think we had a very good discussion around it. I think we have touched upon very important things and actually provided the two contacts, both of your contact, to our people. They can look forward to and address the questions and take it forward if they find they're in that situation. So it will be really helpful to our community. Thank you. All right, so we will get back next month with Sister Afshan, and Jenny, I will talk to you after the call, maybe next week, and we can come up with what other services that we can bring and introduce in our community. All right, thank you. Assalamu alaikum, everyone.
Zach.